All right, welcome everyone. Thank you again for attending this afternoon's program, Spanish Influenza in 1918 Boone County. My name is Lauren Williams, and I'm one of the Adult and Community Services Managers for the Columbia Public Library. Tim Dollens is past president of the Genealogical Society of Boone County in Central Missouri, and the past president of the Missouri State Genealogical Association. And as a senior associate with the Daniel Boone Regional Library here in Columbia, Missouri, he often helps people with their family history and their genealogy research. While today's presentation on Spanish influenza in 1918 Boone County is a historical presentation that is very relevant as we struggle with our own pandemic. So thank you all for being here. And now I'll turn things over to Tim.
Thank you, Lauren. Let's go ahead and click onto the screen here and we'll get started. All right. So the Spanish influenza in 1918 came to Boone County in September, and I'm going to go ahead and start showing you the next screen, which gives you an idea of what downtown Columbia looked like, just to put it in historical perspective. This is actually Broadway. It's a panoramic. You see, it's the same buildings. So you see the old Boone Tavern, and then you see on the top picture and on the bottom picture, you'll see the Victor Barth building on the right, all on North Broadway. But just to give you an idea of what Columbia looked like at the time in 1918, to put it in historical perspective. So let's just go ahead and get started. The Spanish influenza of 1918. First of all, the goal of this presentation is for you to highlight what happened, kind of put it in historical context, and then to discuss what was taking place in Boone County. And I'm only going to cover the first 3.5 months, mid-September to December of 1918, because there's just such a volume of information. I want to talk about some of the faces and places. I'm going to show you some local facts and figures. And we're going to talk about various aspects, and maybe you'll see the parallels with the pandemic of today. And then we're going to leave time for questions at the end. And I put to be continued because it didn't end in 1918, as we all know. Just to kind of an overview of the actual influenza. It was an H1N1 virus, just like the one today is, that first appeared in 4 waves. It killed 50 million people or more in the world. It was very rampant in the United States in 1918 to 1919, which is considered the second wave. And that's what we'll be working on mostly today. The 3rd and 4th waves did hit Missouri very hard as well. And of course, it started in the military sector of the population. Just to give you a sequence of the illness, headaches, fever, pain, sore throat, coughing, running of the eyes and nose. And the fever lasted for up to 4 days or more. And so it takes several hours to confirm if a person actually has influenza, as opposed to something else that might be going around. And of course, many people did survive the influenza, but they end up dying of pneumonia or complications afterwards because of a weakened condition. What was the Spanish flu? What was called the Spanish influenza of 1918. And even though it's called Spanish, it's because Spain was neutral during World War I, but it didn't start in Spain. And I'll talk more about that. Again, it infected 500 million people. And it lasted actually from February of 1918 to April of 1920. A third of the world's population was affected in these 4 waves. And they estimate the death toll between 17 to 50 million and possibly 100 million, making it the deadliest in human history. There's just an image I want to show you that it's in the national realm. The first one is of a U.S. Army field hospital in Luxembourg, Germany, dealing with patients who were sick with the influenza. And then the picture on the right is a picture at the Walter Reed Hospital in Washington, D.C. And you see how primitive the conditions are there, because they're like a makeshift, looks like a porch maybe. And notice the mask that the nurse is wearing and her PPE, or her covering over her normal gown. That's actually normal, because they need to take that off between patients or between visiting patients, just like today. The 4 waves. We're going to talk about the 4 waves and then narrow down onto the second wave, which affected us. You see on the right, there's a picture of a gentleman by the name of Albert Gitchell, and he was considered one of the first cases of the pandemic that started March 4th of 1918 at Camp Funston in Kansas. And there actually probably were some other people likely that had it before him, but he was the first observed case. And then, of course, there was one in Haskell County, Kansas in 1918, prompting a local doctor there, Loring Minor, to warn the U.S. Public Health Service's academic journal because it's getting bad. And of course, Haskell County, Kansas is in the southwest quadrant of Kansas, so it's like 2 counties from Oklahoma and 3 counties from Colorado. If you kind of get an idea of those locations. The second wave that we're going to talk about today started in New York City on September 15th with its first fatality. Liberty Bonds parades in Philadelphia, Pennsylvania in the late September of 1918 resulted in 12,000 deaths due to a major outbreak after that event. So again, that's put there because I want you to get an idea of what types of things caused the disease to spread. And of course, we were also selling government bonds at that time for World War I, Liberty Bonds, and that was going around the whole country to help the war effort. The military being transported on the railways and ships spread the disease not only around the United States, but around the world. I mean, every country had railroads and ships, and of course, the war effort just made it spread even more. And of course, by the end of December of 1918, 292 deaths were reported in just the United States alone. And it was particularly deadly in the under 5-year-olds, the 20 to 45-year-olds, and in the elderly population. However, it did affect every age group. In the second wave, there's also, it was the most deadly of all 3 waves, very contagious. In October of 1918 was the most deadliest month, and we will talk more about that locally. The war-ending parades and the Liberty Bond campaigns didn't help the situation. And then also that year just happened to be a large election year as well. So, and we'll talk more about that locally as well. Because Liberty Bonds were being sold to various campaigns, either through door-to-door or through schools, you naturally see that, contact with people, getting affected. And then the civic organizations also were trying to promote, and there was competitions over who could raise the most for the war effort. And of course, the Great War ending on November 11th also, again, helped cause the surge to continue after the deadliest month. All right, the third wave happened, and starting in January 1919, and it lasted until June of 1919. And it hit the U.S. really hard. It started with the flu in Australia, where it killed just 12,000 people after they just lifted a maritime quarantine. And then as soon as they lifted that quarantine, it quickly spread through Europe, the United States, and then clear up until June, it just kept lingering. Now, primarily it was affecting Spain, Serbia, Mexico, and Great Britain. And those countries had hundreds of thousands of deaths. And of course, here in the United States, the second wave was actually more deadly than the first wave. And the outbreaks kept happening in the larger cities like Los Angeles, New York City, Memphis, Nashville, San Francisco, and St. Louis. And of course, overall American mortality rates were in the tens of thousands during that first 6 months. So again, it's a major issue to deal with on a national scale, let alone a world scale. The fourth wave, we're going to talk about just briefly here, just to get it to round out the 4 waves. It's thought of as starting in the spring of 19 and 20, and it was in isolated areas like the Netherlands, Spain, Denmark, Finland, and Switzerland, and then it went to Germany, and then it went to the South American islands, and then of course it also went into Peru and Japan. They also had their own waves that year. And of course, in the United States, it was hit hard again in the major cities like New York City, where there was just 6,374 deaths from December 1919 to April 19 and 20. You notice a little overlapping there on the waves there as far as the tabulation of deaths. Again, larger cities were being hit again in Missouri. And of course, Kansas City and St. Louis had some of their higher death rates in this wave than all of 1918. So 1920 was actually more deadly than 1918. Of course, we have to, and then here's there's an image of the Red Cross nurses preparing stuff during the 1920 influenza. And then there's also an article out of the St. Louis paper talking about in February of 1920, the number of deaths and how many people are actually 7,275 people affected in the St. Louis area in February of 1920. That's quite a few. 68 deaths in a 28-hour period. That's quite a lot. So now let's get down to Boone County in the second wave. So when did it actually arrive here? Well, in September 1918, during the second wave, there were some deaths that were happening, but they weren't really recorded necessarily as Spanish influenza, but what they were dying of was the same symptoms. But the first case was in Colombia, and it was actually a gentleman by the name of Poe Ewing, who died like October 9th or 10th on 1918. We'll see his death certificate in a few minutes. And 3 days before he died, there was actually a young son of a John Bennett that passed away, and he was like a young Negro boy. And we'll see his, we'll talk a little bit, we'll see an article about him, but there's no death certificate for him. So even though I've gone through all the death certificates for Boone County from this time period to get the total number of death certificates, number that died from the Spanish influenza, I've got at least 3 people that I know of that are mentioned in the papers and other sources where they died of it, but they're not kind of death certificates. And I think part of the fact that this pandemic is going on is part of that reasoning. But this little son of John Bennett, you'll see his name in the paper, but you won't see him as a death certificate because there's not one for him. Again, it started on the UMC campus at the Students Army Training Corps. This is something that was just started as a result of World War I, trying to get students trained. And then of course the reserve officers, the ROTC Corps as well. And then of course, I do want to mention that the African American community was hit very hard during on this, not only in the Columbia area, but also in the rural areas of Huntsdale and north of Ashland. There were still some Black communities around Columbia, and they were hit just as hard as well. And once you see all of some more information on this presentation, you'll understand why that is. Faces and places. I'm sorry I don't have very many pictures, but I do have at least the places that started all this, because it was such a whirlwind. But I'm not going to talk about. I'm just going to let you see the names here, but I'm going to go through every single one of them in the next few slides. So I'm not going to read these off. So some of the faces. So Dr. Guy El Noyes is one of the main people that I was seeing in the papers almost every day, because he was the head of the School of Medicine here at the university, and he oversaw the Parker Memorial Hospital, which is the hospital everyone went to in the community, and the student medical building. And he was also over the resident doctors and nurses on the University of Missouri campus. And at the time, he was headed of one of the top 10 medical schools in the nation. So he's a very prominent figure in town here for the university and for this pandemic. Some other faces that you might think are possibilities or names of people that were in the headlines are Dr. A.W. Campschmidt, who is the president of the local city board of health, a Dr. W.A. Norris, who is also on the board of health, and a Dr. Dolly. And then of course, at the Student Army Training Corps Hospital at the Welch Academy, there was a Dr. E.R. Clark, and he was also the advisor. Dr. Dolly was the SAT hospital at Welch Academy, and then Dr. E.R. Clark was the advisor of University of Missouri Women. And then some of the physicians in the county included Dr. Z.M. Hampton, Dr. C.W. Austin, O.B. Mays, and C.C. Palmer, who were in the Centralia area. But there's clearly more doctors, because people were going to their own local doctor in their community as opposed to going anywhere else, because there wasn't a local hospital except for Parker. And of course, there's nurses at the city hospital and university, and we're going to talk about that. And Miss Margaret Drum is a name that we're going to see a few more in more of our slides as well. This happens to be a picture from the 1919 Savitar that was paying a tribute to the nurses who dealt with the pandemic the previous year. And these are the Mizzou nurses, and I'm not going to go through all their names, but I just want you to know that the list does exist, and it's in the 1919 Savitar, which we have on our library's virtual collection. You can actually go look at that. Park Memorial Hospital. It's still in existence today. It was built in 1889 and named for a gentleman by the name of William L. Parker, who's a local businessman and a Civil War soldier. And of course, his money funded it. And of course, located on the University of Missouri campus. It took care of the students as well as the general population. And it was the first major place victims would go to if ill, even before the quarantine. Then we had the city emergency hospitals. Now, emergency hospital in Columbia didn't develop, ironically, it developed in August of that year, because we actually had in Columbia a typhoid trace to milk. And because of that, the city's sanitation inspector decided that they had to have a hospital. So A 14-room house on 7th Street was near Elm Street was actually rented to make it a makeshift hospital for the people who were actually coming down with typhoid fever, and then they also during the pandemic they had to get another annex. They called the annex at 603 East Elm because there was such the overflow of the actual people being sick. And of course, this was a big financial burden to the city's budget once people started getting sick, because there clearly was part of it was, people were being hospitalized, they couldn't afford to pay for it. Now, at the very end of the year, I'll tell you more about, but basically all the equipment at the very end of the year, because the budget was sold to a private person. And this became the impetus for the beginning of what is now known as the Boone County Hospital on the east side of downtown, for which a bond was voted on in April of 1919. So I'll let you understand, what's happening as a result of things happening. Just so you know, this is more another article that talks about the hospital and the management of it and how they're trying to pay for it. And then this is in November, and they've already been open since August, and they're struggling. And then, of course, if you notice, it says one ward in the hospital is provided for charity patients. The admission of charity patients is to be approved by the hospital committee. So a person had to have the financial need in order to get to the hospital if they couldn't afford to pay for it. But then at the very end of the year, because they couldn't afford for it, you see December 30th of 1918, they really can't afford it, and they're going to go into next session, and actually close out the hospital and sell the equipment. So just to give you an idea of what's going on, and they have to balance their budget. All right, so the Welch Military Academy, I didn't know this existed until I did doing research for this presentation, but at the south end of Garth and Rollins, in the southeast corner, in what's now the Sigma Alpha Epsilon fraternity, is the old Welch Military Academy, which was actually a military academy for young boys. And that ended up becoming a ward hospital #1 for all of the victims, of some of the victims of this pandemic. Of course, mostly it was men. But that facility ended up becoming and that facility actually on the right is still there. And you can kind of see it if you go down the trail behind the houses on the corner of Rollins and Garth. But nestled behind there, the house is facing the actual railroad or the trail now. The Kappa Sigma Fraternity House on campus was also turned into a war hospital #2, and it was mostly men. And then it just so happens that the Athens Hotel was the only major hotel downtown except for the Boone Tavern Hotel. And they ended up becoming another hospital. And when you see the numbers later in the presentation, you'll wonder, wow, how could you get that many people to fit in there? But that building, again, is still located downtown Columbia. It's still in existence on the northwest corner of 10th Street and Walnut. But that, again, the Athens Hotel was turned into a makeshift hospital because all the number of people that were needing it. Then, of course, we have Reed Hall. Now, Reed Hall is on Hitt Street, just north of just south of Memorial Union, on the east side, right before you get the agricultural building. And it was actually the first dorm for women on campus. And it was known for a lot of what they called the elite women of campus were able to live there. But it was turned into another hospital for women only on campus. And of course, you see one of the rooms inside, one of the rooms for the typical room in Reed Hall before it was made into a hospital was an actual room for students while they were visiting here, or while they were the students here. Let's go to the next screen. Okay, so health orders. You see right now, in October of 12, things are starting to get ramped up here in Columbia and Boone County, and it's hitting hard. And you see where the Columbia Board of Health, they're telling the schools to close and the city to close. And they're just, all these things are trying to get people to, quarantine themselves and, try kind of stay healthy. So this is October 12th, which is a good date to remember because once, and they're saying, look, no public gatherings, no church services, and you can't do this until further notice. So they're doing this in October 12th, shortly after the few first deaths. And of course, here's some articles that talk about some of the influenza. Imagine one time having 50 cases. Dr. Noyes was talking about, and that's just at Parker Hospital, which basically it's students and the population. And then, of course, they're starting to run over and put the patients in the rest of the hospital as well. But he also mentioned in the paper that it takes 24 to 36 hours to determine whether the patient has influenza. So a lot of times patients were coming there with really bad symptoms, and they were just playing the waiting game to see if it was influenza or something else. The next thing we have is going on is that they're needing help. There's not enough people to take care of this. They're needing help to have people to come and help patients. You notice that it was mentioned in the paper that there's a Dr. Moore, who was a Negro doctor, who had reported that there was 2 of his patients had disease. Now, this is at a time when, unfortunately, Columbia was, a lot of times, services were separate. The African Americans went to the Dr. Moore, and other people went to other doctors, but this is what Columbia was like in 1918 in a lot of ways. I will notice that you talk about the number of cases and the crowding conditions, and the Athens Hotel was opened up on October 12th of that year because of the congestion. And then Army Hospital number 3, the Phi Kappa, was going to start sending all of its cases to the Athens. And of course, Hospital number 3, we just talked about, was going to be opening up. So they're getting all these crowded up just by October 12th. And then of course, we go over to the next article I want to show you is that the influenza detained 107 who were in call a week ago. So the military, people were still being drafted for the military draft because the war wasn't over, and it was actually actually causing havoc on people who were supposed to be going into the military because the draft. They had to hold off because the influenza was affecting the numbers that could go and who could go and who couldn't go, because again, you can't put somebody in close quarters because they're going to spread the disease. A need for supplies. Just an article, and again, it's October 12th is kind of like the date that everything was just like booming in the paper with information. It's kind of like our March 17th, so to speak, here in Columbia this year. And look at the stuff they're looking for: sheets, blankets, nightshirts, mops, everything you think about you need at your home, but you're coming to a hospital, you need to keep things separate for each person. And then of course, they're actually for people for automobiles for people to transfer people to the actual hospitals. Because again, some people don't even actually have automobiles then, let alone to hitch up a horse and bring them to a hospital. They just don't have, and they're too weak to get anybody. And of course, the Red Cross is becoming the collector and the distributor of all these, which is typical. And thank goodness the Red Cross was the force that's doing that. Masks. Masks were being utilized by the health professionals because they knew that it was a very airborne disease, and so they were wearing masks. And then it became the brain of what some local businessmen said, hey, well, if they're wearing masks, maybe we should be wearing masks. And so then you start seeing all the people started wearing masks because they wanted to stay open, but they also wanted to be protected. And for people who had to actually go to work and be where their job was, like the banks, they certainly had to go and still work. And so they were actually making masks. And actually in the front windows of many businesses, there was a Red Cross window that showed you how to make a mask and how to buy the material and how to actually make it one that's real easy to use, but to protect yourself. And they were encouraging all of that. And by the way, in addition to masks, the local businessmen and women, they actually were limiting people into their businesses as well. So if you were coming up to go get your weekly supplies at your local mercantile, you had to sit outside and wait in your car or your wagon until a family they were taking care of was done, and they'd take the next few people, so they would keep the people not in the same quarters, because again, being outside with fresh air was important, and at least that's they thought at the time. Muslin was the material for masks, which I thought was really interesting, because I know what muslin is, and I know how it's stretchy, but I thought it was very fascinating they were using muslin as opposed to cotton. And so I don't know why it was that way, but maybe someone will know. So here's some of the rules they were talking about just to keep yourself safe from getting the influenza. I'm gonna go through some of these. And this is just from a circular that the Red Cross sent out to, again, they're putting out information to let's say, hey, these are your safety features, things to do so you can keep yourself safe. And again, I want you to look at these and figure out if anyone are familiar with today's outbreak. A person, obviously, if you're sneezing or coughing and spitting, you just need to cover your mouth and your throat and not scatter throughout the air. Avoid crowds and not avoid close-to-close contact with people, and use a handkerchief over your nose and your mouth when coughing or sneezing, and to dress accordingly to the temperature. Fresh air, again, keep your bedroom windows open to get the air flowing so it's not stagnant. Keep your digestive organs, like eating a well-balanced diet. Drink water freely so you're flushing out your system. Avoid common drinking cups, so don't use anything common. So again, and of course, washing your hands frequently, wherever we heard that. And of course, using a mild antiseptic as a nose spray or a mouth gargle was good for your throat, but it also helped you. It was designed to help you keep down your sneezing and your coughing, so you wouldn't be basically extending the disease to other people. And of course, once you get affected, make sure you stay stay close to, stay confined. And then if you get any of these symptoms, call your doctor immediately to see if whether it's influenza or it could be something else. Therapeutics and cures. I'm always fascinated by the therapeutics and cures that came up during the 1918 pandemic. And you're just the actual local Missourian. By the way, most of the articles that you're going to see are in the Missourian. There are a few that were from some other papers, but for the most part, they're from the Missourian. And I put the date underneath them, so you'll be kind of being aware of the date and the time during this time period. But using creocyte for influenza was something from a brainchild, Dr. Bayer, at a homeopathic hospital in Pittsburgh. And so I'm not sure if that with a combination of iodine and creosote, I don't know how it worked, but I didn't see the results of it, but that was being pushed around. The University of Missouri Columbia at Parker Hospital had a blood transfusion for pneumonia cases, and they were trying to do that. And this idea was to, when a person recovered from pneumonia, the veins, the person would be critically ill, and they would drain all of their, they would transfuse all of, they would have apparatus that drained all of their fluids so that they wouldn't get pneumonia. And then this was actually, believe it or not, this was actually, the University of Illinois hospitals actually used this method later on because of the results, supposedly the results that were doing in the University of Missouri Columbia. So that's kind of fascinating. And then of course, a doctor in Richmond, Virginia was found as a cure for pneumonia, according to this in 1922. So again, you're getting all kinds of cures and therapeutics. Now we're going to get to some of the headlines of the first days of the pandemic when it was hitting hard. October 9th, you're seeing the mention of this young boy who passed away in the Sugar Grove area. Now, Sugar Grove in Boone County is about 4 or 5 miles southeast of New Haven School, roughly, in that neighborhood. And he was really the first young person out in the county that's declared a victim of the Spanish influenza. But there clearly were some other cases that had pneumonia and influenza, but it wasn't called Spanish influenza. A few months, and then of course we have this Poe Ewing. Can you imagine your parent? You're at the university, you're a student, and you're training, and then your parents get a phone call saying, "Hey, your 18-year-old child is in the hospital." They're rushing down to get here on the train or wherever to get to him, and they actually he passes away before they get to see him. And so then they end up just taking his body back home to Darlington, Missouri to bury him. And of course, you also have, now is it circulating in the city, it's also out in the county. And so you're seeing another young person here who's dying. And then of course, you see in the very bottom of this article, it says, Mrs. Nora Crum, a Negro woman, died of pneumonia superimposed by an attack of Spanish influenza this morning. She lived 1/2 mile east of McBain. And for those of you who don't know, McBain was a largely African-American community clear up from the time after the Civil War was over. That community was very highly populated with African-Americans. Many of them came to Columbia for jobs or moved away with going to the city for jobs, but several still farmed and were agricultural in the McBain area. Now, some death certificate. Here's Poe Ewing's death certificate, and you see it just says lobar pneumonia, 18-year-old. Here's his parents, and of course he's being buried in Darlington. I've already talked about that. Here's another, is that J.H. Young Jr., And of course, there's not a death certificate for John Bennett. So I don't know if it was just because they didn't go, no one went to him and fill it out, or they didn't go down to the county to fill it out, but there's not one existing for him. And by October 16th, the second week, the disease is growing, and we've got cases. I want to mention some of the cases here. Just in the second week, you've got 42 people in the Parker Hospital. You've got 29 in the city hospital plus their annex. You've got 53 in that big old Welch Academy, Ward number 1. And you've got 20 men over at the Kappa Sigma. And you've got 11 women over at Reed Hall. And then you have 118 people in the Athens Hotel, the third one, 118 people. And that's not even counting the 100 people that were in quarantined at home. So again, and if you look at the October 19th, Jefferson City was reporting that 10,000 cases are already in Missouri. So we already have to, just in a month or less than a month, we have 10,000 cases of Spanish influenza that are being documented that way, based on all the reports from all of the medical professionals around the state having to report to the state. So it's pressing. MU closes for a week. Dean Isidore Loeb ends up closing it. And of course, they're strongly suggesting that people do not refrain from railroad travel because that's where people are getting. And sure enough, a lot of kids went home for Thanksgiving that year because they want to go see their parents, and they brought it back. So it wasn't really good about that. And then this next article is just, it's later when they reopened. And I'm sorry, I don't have the date there, but it's just, they had some new guidelines. And I'm gonna go through those guidelines later, but I want to show you that there's an article that talked about they're opening back up, you know, a few weeks later. And of course, that doesn't always work out. So we'll see. Here's some other death certificates of a gentleman, an 18-year-old dying of, again, flu and influenza from Rocheport. He was a student. Here's some more deaths that talked about the numbers. In October 16th, you see the numbers are still rather high there. And then, of course, here we've got, they're talking about the schools opening soon. So we've been closed for 2 or 3 weeks. We're like, oh, maybe we should open back up right before Halloween, right? And so they're talking about the numbers are going down in the hospitals. It's kind of going down. So let's just go ahead and have schools open back up. Well, I'm not gonna have a screen on this, but I want to tell you that 2 weeks later, they had to close back up right before Thanksgiving and be closed for another 2 or 3 weeks or until the end of the year, because people, as soon as they opened up for 2 weeks, they had 20 cases of just in one day of the influenza coming back. So again, going back to school wasn't exactly the option, even though everyone was being encouraged to do so. Now, Liberty bonds being sold, I told you about that on the national level. Well, they were big in Missouri too. And of course, every county was competing. There was like a competition of who could raise the most money for our boys and girls on the front line. And so you're having all these people going around getting money and trying to raise money, and they were hitting out everybody. I mean, they were having the kids in school collect the money house to house. And so right now in October, that was the big push for this. And of course, I've already told you about the parade in later on in Philadelphia for this, trying to promote this. But again, this is one of the events that happened that unfortunately caused, you know, people to get more sick. Then we had this big election going on, and it was a major election. It happened in November, November 6th, November 5th, and November 6th. They actually, this is the front page of the paper. But I wanted to show you this because look at the items that were up for. There was the 9th Amendment that was coming up for election, which was a prohibition on was on taxes actually in Missouri, and they were trying to you know, prohibition was a big deal, and they were trying to tax it, and so that was on the ballot. And of course, we had to elect a state senator. And then, of course, at that time, Columbia and Boone County is pretty Democratic. And they still are, I mean, in a lot of ways. But even then, they talk about the fact that Columbia and Boone County is a Democratic community in 1918. But what's actually happened, if you'll notice that the Republican Selden Spencer won by 20,000 votes for the whole state, and then Prohibition lost by 70,000 votes. So the people who were wanting people not to drink said, nope, sorry, we're going to drink. So again, you see the local election summary for the local people. Columbia voted to be dry by 158 people. I'm sorry, Columbia voted to be dry by 392 people. We wanted to be a dry county, but we were not. We were defeated on, and so we became a wet state. But again, people voting is another reason, you know, people are going. And then we have World War I ended on November 11th. And right here on the front page of the paper, we've got girls, soldiers, and the flags swirl around the parade here in Columbia. And they're having a parade right here in downtown in November, even though there's been a spike. And we're all right here having a parade to promote that the Germans have surrendered and the war is over. Okay, then again, you see it's back in October, it's not getting any better. And we're all the hospitals are kind of shifting around who's going where. And of course, the city's also you know, having some issues with the financial, but they're talking about they're also giving talking points on like keep out of doors as much as possible, even if it's raining. Now, who does that? Or the inclement weather may increase the spread of the influenza because people will crowd into buildings and spread the germs. Where have we heard that? I mean, it's just one thing. As all you see these little things on these screens are like, sounds familiar, right? Then we have some sad stories. We have one. There's a husband and wife who are, you know, she's 18 and her and her husband are living here in Columbia with another relative named Susan Perkins. And they're living in a house here in Columbia, and they're from the Southwest town, but they're probably living in Columbia because that's where the jobs are in the factories. And 3 of them in one household die within 3 or 4 days. It's just really sad. So here she is. There's her death certificates of Orme Smallwood. Her husband Harrison dies on October 27th around 8 p.m. And then 3 p.m. the next day, she dies of the exact same disease. And then the third person in the family, Susan Perkins, dies, and she's clearly a relative of Orme, because Orme, you see, Orme's mother was a Perkins. She was a Perkins, and there's not even a death certificate for her, so we don't know if someone just didn't know anything or just didn't have it. But all 3 were buried in the Nashville cemeteries in the southwest part of the county. But it's just a sad story that it wiped out a whole, you know, small household. Again, on October 20th, it's on the wane. And they think they've passed the big hurdle, that everything's going cool. They think the cold weather is stamping out the disease. If we have clear cold, we'll see. But again, this is October 23rd. Of course, I've already told you that there's a spike. This is another article about some more people dying. And I wanted to mention this just because, again, the students are still being moved around based on where they are, but these students are still dying on campus. And now, luckily, a lot of people are surviving it, but some people are, you know, they're just, you know, they're getting a bad case of it and they're dying. So we just right now we're getting a daily report in the paper of what's going on. Here's some more. Here's an African-American child, 2 years old, named Nathan Anderson, that died. And he lived buried around Log Providence, which you know is like just north of Ashland. And here's some more death certificates of, oh, I'm sorry, it's the same one. Here's one. Here's a sad story where you've got this little bitty 3-hour-old infant, just 3 hours old, and the cause of death is pneumonia. And this happened on December 26th. And then you roll over the next day, and on the 27th, the poor baby's mother, Mary Bowen, age 27, dies of pneumonia. Brought on by what? Influenza. Just really sad, heartbreaking stories about whole families being wiped out from this disease. And so here she's got the disease and she was pregnant, and then she had the baby, and then the baby died 3 hours, and she died just, you know, from just 24 hours later. I mean, it's just so sad. And then we have a 38-year-old woman here who's around the Centralia area dying it. Again, they're getting the pneumonia, and of course, after the influenza, and that's just kind of the course of it. You're getting weak from the influenza, then you catch pneumonia and you die. Just really sad. Here's M.R. Conley was a well-known lawyer in town from a well-known prominent family. 45 years, never married. He caught the influenza and died as well. Didn't last very long, from November 27th to November 28th. So it's not much of an incubation period. We got some more of the African American period from Log Providence dying, a 3-year-old. And then this is a little child named John Ellis. And then He's dying on October 19th. I'm sorry, I'm switching back and forth, but he dies on the 19th at 10 p.m., almost a 4-year-old. And then the next day, his mother, Narcissus, dies at 10 p.m. Can you imagine the heartbreak of losing your child and then being sick and then knowing that, and of course, then you pass away the next day? Just another sad story that was going throughout the whole county. I want to go back now and go back to the rural areas and talk about Centralia and how they dealt with the pandemic. It's a little bit different than what Columbia was doing. Of course, they only have a weekly paper, but then this is just like in Columbia, they did actually close down voluntarily the churches, the schools, and the theaters, and some of the other places that where people would congregate and stay for a while. And just, there's just out of common sense, they were doing that because they wanted to be safe. And so this, you see why they're mentioning this in the paper, but it's only a weekly paper. You don't get, it's not like a day by day what to do. It's coming down in the paper, every week through word of mouth. And then this is them telling you what the dangers are and what you should and shouldn't be doing. And it talks about having, eating properly, having a good diet, sleeping well, don't be in overcrowded homes, and open the windows, and just all the major things you're seeing again. But again, cover up each cough and sneeze. If you don't, you'll spread disease. I mean, that was just one of the little catchphrases that was going around with the health department, just as a reminder. This is pretty common at that time period to have catchphrases that be easy to remember for kids to recite. And again, in all health matters, follow the advice of your doctor and obey the regulations of your local and state health officers. And that's important because all health officers were actually based on your local town, not the county. So Centralia gets a little issue because the local doctors there, someone contacts the state board of health, and the governor sends saying, "Hey, what are y'all doing up here? You're not following protocol." And it prompts the mayor to send a letter saying, "Hey, we're following all the guidelines we need to. We're being safe, and we're not up to the point of what they call what we call now the positivity or the rate that it should be of deaths per 10,000 or 1,000." And so they're not doing the same thing protocol. Their businesses are staying open. They're just following good practices like everybody else with the mask, but they're not closing the schools down like Columbia did. And so then the doctors and the mayor have to send a letter and he typed it in the paper, and it was a big controversy. But once this letter was put out, they got a response from the secretary of the governor, and then it just kind of went away. And of course, basically just saying, look, it's under the local control. You all have it under control. I'm out of it. So that's kind of the way it was. It's under local control, just like we see today. And that's why I wanted to bring it up, because it is different than what we're seeing in Columbia, even at that time. I wanted to mention these obituaries here because these are not normal obituaries for this time period. They're small, they're to the point. They're all people who died of influenza. Usually see a nice big obituary like 2 or 3 times longer, but because because it's such a contagious disease, I think they're just not getting the information from the family members. They're just burying someone quick and moving along, so they're not going to be exposing anybody to write down someone's life story and getting it published. But this is and you'll see that change once the pandemic's over. I want to put this article in here because it talks about the local drugstores and what they could offer you for kind of like therapeutics. You got your cold tablets, your cough syrup, your mentholatum, Vicks Vapor Rub. And Vicks Vapor Rub you couldn't find on the shelf, because Vicks Vapor was kind of like our toilet paper of today. You couldn't find it on the shelf because people were buying it up to rub on their chest. And of course, Listerine to keep your mouth sterile. And I don't know what bromoquinine is, but I'm sure it's to keep you something to keep you healthier. But I have no idea. And of course, they had DeWitt's cold breakers and then pine cough syrup. So you get it off in your local drugstore. Hey, I mean, that's back when the drugstores where everything was there, including the ice cream shop, right? Okay, so then we're getting back to Columbia now because we're talking about the city hospital is having a deficit. Look at that, $3,859 deficit. I mean, they're just like struggling. They got $2,000 worth of equipment, and the charity work it's just not enough. And then they're talking about all these things. Of course, Margaret Drum is their superintendent of the hospital, and she's trying to defend her management. They said, look, we have to keep this open. There's people here. We're doing charity work. These people need this. And they're just running low on funds. And so they end up selling the equipment later on to Miss Drum and some others who end up still having some kind of a makeshift type hospital in Columbia after this pandemic is over, or actually during the later years of it. We received back in December, the school's going to open up the first of the year because maybe they closed after Thanksgiving. But here's what I think is very fascinating. If you were a university student coming back after Christmas break, and they came back like the first week of January, it wasn't like they came back 3 weeks after the January, you had to go and purchase a mask and wear it all the time on campus. And you had to pay 10 cents for that mask. And if you look over to the right here, you'll see that they actually sold 850 masks. While next we go. So 850 masks were sold to the students at 10 cents a piece when they came back to school. And then the other thing that students had to do is they actually had to males come to one place, females to another place for a influenza vaccine. And they had certain days they had to come there before they go back on campus. And if you missed those dates, you had to come back on January 1st to get the vaccine at the regular clinic. So you couldn't come back on campus unless you got this influenza vaccine that was available, and then go buy a mask. So they're telling you what you have to do to get back on campus. And then here we have on the last day, we got some more deaths, and I'm trying to watch the time. So I just want to let you know that people are still dying of this disease. There are people who live here, people who don't live here. There's this young gentleman from Oklahoma City that dies, and they can ship his body back up to Oklahoma. Of course, another infant is dying. Again, it's just already gone through the whole county. It's just rampant. Now, if you think about this whole situation, the following April of 1919, you'll see an ad here. It says, why you should vote for the Boone County Hospital. And of course, you see there, we didn't have a hospital. We only used the Parker Hospital on campus, but it wasn't big enough. And there you have it. There's a postcard picture here of what became of, by 1920, the first Boone County Hospital. So again, I want to point out that at this time in 1920, there was only 3 county hospitals in the whole state. Audrain County, Callaway County, and Boone County in 1920 were the only 3 county hospitals in the state. The rest of the hospitals were city hospitals in St. Louis, Kansas City, Springfield, and St. Joseph, the larger cities. But no other hospitals were, if someone got sick, they went to a local doctor's office to be taken care of, or the doctor saw them in their home. But Audrain County, Callaway, and Boone were some of the first 3 county hospitals in the state of Missouri. All right. I want to thank the Columbia Public Library for allowing me to do this presentation. And I use a lot of things from newspapers.com and Missouri Death Index, which is the Missouri State Archives. And I use quite a bit of information from the State Historical Society and the Boone County. And I'm going to go ahead and then American History Online database. That's something the library offers here through one of our databases. So you should go check that out. And I put to be continued because the pandemic's not over in 1918. And so we'll see. And hopefully you've enjoyed the information you have. I know it's a lot of information, and now we'll just maybe I can answer some questions you might have.
Sure. Yeah, we've got several questions that have come in through the chat, Tim. Thank you so much. One question that came in early on was the Parker Memorial Hospital on campus. What is that building's use today, if you know that?
I don't know exactly what it's used for today. I wish I did, but I know it's still on campus. I know that the medical building is still there for medical students, like student health. So student health is still in that part of town, but I don't know if the Parker Hospital is still part of student health or not. But I know that the medical building next to it that was built later is there. But it could be still part of. I know in 1985, 83, 87, it was still student health when I went there as a student.
So some questions about what school age kids did when the schools closed. They don't have online school. Right.
Well, you know, they were just without school. I mean, I found nothing in the papers reading it daily about what the kids did to learn. They were just out of school. I mean, I don't think there was anything. I've not learned of anything that mentions anything in the papers about schoolwork being sent to them. It was just kind of like a shutdown. It's almost like just a shutdown of everything to keep the people who are going to be the most vulnerable to be staying away from crowds.
One of our participants says that about the Parker Memorial Hospital, that the psychology students use it now for research.
Oh,
So
there you
thank you for
Yes.
one of our attendees telling
Yes.
us that. Another question, in his book on the Spanish flu, John Barry points to a lack of political leadership at the national level with Woodrow Wilson's administration in some of states and cities like Philadelphia. Do you know if Missouri and Boone County politicians showed leadership during influenza, or were they trying to minimize it?
I have not seen anything in the papers, reading them daily, in the Columbia, as far as doing this research that showed much about it was just kind of pushed off to the health department. The mayor and the health department were the ones that were basically in charge of the local health. And it happened such a sudden event that no one else was talking about it except for the mayor and the people they appointed to be the health directors at the city council meetings, which were appointed. They were appointed in August because of the typhoid scare and trying to get a hospital for that, because we didn't have enough people in Columbia. They clearly knew that the Parker Hospital on campus wasn't enough to take care of people who were dying of typhoid in August. So we were having two major health things going on in 1 year. I mean, so no, I've seen very little on the local politicians or even the state politicians for that matter, except for the governor trying to tell people to be more quarantine more in Centralia. The governor was putting pressure on them to buckle down. The local health people said, no, we've got it under control. So
does it seem like it wasn't quite as politicized as COVID?
No, not at all. Not in the papers in Columbia.
Okay.
And that might have been, I haven't read through all the papers in the Tribune, but the Missourian didn't show much of it at all about. Again, most of it was on campus, and the campus was taking care of themselves. They were doing their own thing, and they were making their own restrictions for their own population because the students were coming to their campus. So they were having their own stipulations regardless of what the state was doing, but they were following all the guidelines. Again, Dr. Noyes was well known throughout the country, being a well-known doctor, and the medical school was actually in the top 10 in the country, according to. In fact, they just got an award earlier that year for that being one of the top medical schools in the state or the country, which is kind of fascinating.
You mentioned this briefly about the name Spanish flu. Could you elaborate on why it was called Spanish flu? That was kind of political, wasn't it?
So that was political. So Spain was neutral in World War I, and it never even started there. But they named it the Spanish influenza because it was starting over in Europe. It was starting over into troops, and because they were neutral, they just called it the Spanish influenza because it hit everybody the same. I mean, it didn't matter what side of the war you were on. It was neutral. You hit everybody. There's no side to who gets it and who doesn't. If you're in someone's air and they have it, you're going to get it. But the only thing I've seen on that is that it was called and unfortunately they get blamed for that. But it wasn't because it was the first case was there at all. And the fact the first case was in Kansas for the most part.
So people were sort of angry that they stayed neutral, and so they called it that.
World War I, right.
Okay. Do we know how many deaths occurred worldwide from the Spanish flu epidemic?
I mentioned the very first part, was it 292,000? But I know that, let me see if I can go to that first few screens, if I can get to it. I mentioned it the very first, the first heading of it, because it was one of my points I found. I want to get that in there, the very first part of this. I will say locally that when I was doing my research on the death certificates for locally from Boone County, roughly about 130 people died in Boone County between September and December of 1918 alone. So to me, that's pretty major to lose that many people, because we're not that big of a county in Boone County. We're maybe 20,000 people for the whole county in 1910. Let's see if I can find this. The very first part mentions the number of people. Well, by the end of 1918, 292 deaths were in the United States. But let's see if I can find the one where it talks about the world, because I do have that. The death toll between 17 to 50 million and possibly 100 million, making it the deadliest in human history. 17 to 50 million for the whole world.
Wow.
For the whole 4 waves.
We have some folks who are chiming in about the name Spanish influenza, that there were also Spain's newspapers were not subject to wartime censorship, so that they reported on the pandemic before other countries. And so that's another reason that it would be called the Spanish flu.
Gotcha. Okay.
So someone asked about the use of the word Negro and not African American, and I can address, I think you're reading off of the historical documents.
Document at the time, it said,
Yeah.
I was reading that, I was actually, paraphrasing, or I was actually reading the actual item. That's what the time period, that's what the actual article said. I wanted to get the exact wording so I wouldn't mess it up.
And I think that's one of the parallels that
right.
the African American community was heavily affected,
yes.
more heavily affected than
right.
because of lack of access
right.
to
exactly.
healthcare, and that
right.
we're seeing minority populations
right.
hit
and
more heavily by COVID too.
And some would say living in closer quarters sometimes too.
Yeah.
So yes, right. All those things. Yeah. All those things matter when it comes to a deadly communicable disease.
Yeah.
So yeah, lots of parallels. Yeah. The parallels, I want you all to figure out what the parallels are, because there are many.
Yes. Yeah. Someone pointed out early on that the spread from the cities to the counties took longer than it is today, I believe. So it had a parallel about how fast it took to spread
right.
from the cities to the county.
Right. And actually, I have some death certificates that, to me, I think they've died from Spanish influenza, but they weren't. They just had. It just wasn't. They were isolated. They weren't like. There weren't no other people weren't getting sick like everybody else was, but they were dying, and the local doctor was calling it la gripe or some other disease. And then all of a sudden, we got this pandemic. People were dying, getting sick left and right, and it's getting communicable. Then there's like, oh, maybe this is the Spanish influenza. But I have a few deaths that came in September that I would say were Spanish influenza in Boone County, but they don't record that on the death certificate. It's just, so yeah.
Had a question about the economic impact. Did people lose jobs due to the Spanish influenza? And do you have any information?
Well, there was nothing mentioned in the papers about this, but for the most part, like I said, some of the businesses were open, stayed open. They just did unless you were sick. Quarantining then was you only got quarantined if you got sick. So the school was still open. Colleges, the schools, the public schools closed, the college closed for a while, reopened back up. Businesses were still open. It's just that they did change their hours, just like we did to do today. And people wore the mask, and they did limit the number of people coming in the store. So, but see, the economics then were different then because a lot of people grew their own foods. And if they came to the grocery store, they'd trade stuff out, or they did buy stuff. But the economics of a family is different then than it was now, where you would go buy. We have a run for toilet paper. They're having a run for Vapor Rub. So the economic issues. You saw how many people were in the hospital for the that were in what they call the charitable part of the hospital. And there's you see the city's deficit was in the $38,000. I think I'm seeing that in front of me, but by the end of the year, but just in 3 months, they're struggling to pay this money, and they're having to sell everything off and close up their hospital because they can't afford to have so many more people in the hospital that they can't afford to take care of. So, any other questions, or does that answer it?
There are a couple more, but we are right at 2:00. So I think we're going to have to go ahead and call it good. I really appreciate everyone coming today. Lots of good questions, really interesting historical documents and information. And really appreciate you, Tim, sharing your time and expertise with us. People did ask if this recording would be available later, and it will be. So it'll be on the library's YouTube page or YouTube channel. And also we are, I'm going to drop a link here in the chat, dbrl.org/events. You can visit that. Site, and you can see not only what's coming up, but there is a section called Recently Live, and you can browse there and see what we've got recorded. That's where our story times are also have links to those. So any past programs we were able to record, that's where those will be. Thank you again for joining us. We really appreciate it, and we will see you online again soon. Everybody, please be well.